Question 1. A prescription for atenolol 50 mg states, take 1 tablet by mouth daily. What is atenolol primarily used to treat? I. High cholesterol. B. Depression. C. High blood pressure. D. Diabetes. Answer C. High blood pressure. This question tests knowledge of common cardiovascular medications and their uses, which is critical for a pharmacy technician. Atenolol is a beta blocker, and the keyword primarily used to treat indicates its main therapeutic purpose. Beta blockers like atenolol work by relaxing blood vessels and slowing the heart rate, effectively lowering high blood pressure and helping manage conditions like angina. For example, a patient taking atenolol daily is likely managing their hypertension. Remembering that drugs ending in -ol are often beta blockers for heart conditions can be a helpful memory aid. Question 2. A prescription is written for amoxicillin 250 mg per 5 ml. Take 5 ml orally 3 times a day for 10 days. How many milliliters, should be dispensed? I. 50 ml. B. 75 ml. C. 100 ml. D. 150 ml. Answer D. 150 ml. This question tests basic pharmacy calculations, specifically determining the total volume needed for a liquid medication. The key information includes the dose per administration, 5 ml, the frequency, 3 times a day, and the duration, 10 days. To solve this, first calculate the daily dose, 5 ml x 3 times/day equals 15 milliliters per day, then multiply by the number of days, 15 ml/day x 10 days equals 150 milliliters. It is essential for a pharmacy technician to accurately calculate the quantity to dispense to ensure the patient has enough medication. Always double-check your math before dispensing any medication. Question 3. Which federal act requires that patient health information be protected and kept confidential? I. Poison Prevention Packaging Act, PPPA. B. Occupational Safety and Health Act, OSHA. C. Health Insurance Portability and Accountability Act, HIPAA. D. Drug Enforcement Administration, DE, Regulations. Answer C. Health Insurance Portability and Accountability Act, HIPAA. This question evaluates understanding of key pharmacy law, specifically regarding patient privacy. The keyword protected and kept confidential directly points to the Health Insurance Portability and Accountability Act, HIPAA. HIPAA sets national standards for protecting sensitive patient health information from being disclosed without the patient's consent or knowledge. For instance, a pharmacy technician must ensure patient conversations are private and that computer screens with patient data are not visible to unauthorized individuals. Remembering HIPAA's primary role in safeguarding patient information is crucial for maintaining legal and ethical standards in healthcare. Question 4. In a sterile compounding environment, what is the most critical aspect to prevent contamination of compounded sterile preparations, CSPs? I. Proper labeling of vials. B. Wearing appropriate personal protective equipment, PP. C. Maintaining aseptic technique. D. Using an automated compounding device. Answer C. Maintaining aseptic technique. This question focuses on sterile compounding principles, with most critical aspect emphasizing the primary control for safety. Aseptic technique, which involves specific practices and procedures to prevent microbial contamination, is paramount in sterile compounding. While PPE is part of it, and proper labeling is important, aseptic technique encompasses all actions taken to keep the preparation free from germs. For example, meticulously sanitizing hands and surfaces, and correctly manipulating sterile ingredients within a laminar airflow workbench are all components of aseptic technique. Always remember that strict adherence to aseptic technique directly impacts patient safety by preventing infections from contaminated CSPs. Question 5. What is the primary purpose of tall man lettering in drug names? I. To indicate a drug that requires refrigeration. B. To highlight the brand name versus the generic name. C. To differentiate between look-alike/sound-alike medications. D. To signify a controlled substance. Answer C. To differentiate between look-alike/sound-alike medications. This question tests knowledge of medication safety strategies, specifically concerning drug nomenclature. The keywords tall man lettering and primary purpose directly relate to distinguishing medications that might otherwise be confused. This strategy uses uppercase letters for parts of drug names that are similar to others, like hydrobupropion and hydromorphone, to help reduce medication errors caused by visual or auditory confusion. For example, a prescription for bupropion should immediately make a technician think about the visual difference with buspirone. Always pay close attention to drug names, especially those with similar spellings, to prevent dangerous mix-ups. Question 6. How often must a pharmacy complete an inventory of all controlled substances? I. Annually. B. Every 6 months. C. Biennially, every 2 years. D. Monthly. Answer C. Biennially, every 2 years. This question assesses knowledge of pharmacy law and inventory management practices for controlled substances. The phrase "how often" and "controlled substances" points to specific federal regulations. According to the Drug Enforcement Administration, a complete inventory of all controlled substances must be conducted biennially, meaning every 2 years. This inventory is critical for tracking these highly regulated medications and preventing diversion. For instance, a pharmacy must count all Schedule II, III, IV, and V drugs on hand and record the exact quantities. Keeping accurate and timely controlled substance inventories is a fundamental responsibility for every pharmacy. Question 7. Which of the following is the generic name for Prozac? I. Sertraline. B. Fluoxetine. C. Citalopram. D. Paroxetine. Answer B. Fluoxetine. This question tests recognition of common brand and generic drug names, which is vital for safe and accurate dispensing. Prozac is a well-known antidepressant, and knowing its generic equivalent, fluoxetine, is a basic requirement. The other options are also antidepressants, but they are generic names for different brand medications. For example, if a prescription specifies Prozac, a technician should know to look for fluoxetine if a generic substitution is permitted. Mastering the top 200 brand/generic pairs is essential for every pharmacy technician. Question 8. A patient brings in a prescription for Vicodin, a Schedule II controlled substance. Which of the following is true regarding refills for this medication? I. Up to 5 refills are allowed within 6 months. B. Refills are permitted if authorized by the prescriber. C. No refills are permitted for Schedule II medications. D. Refills are allowed only with a new written prescription each time. Answer C. No refills are permitted for Schedule II medications. This question tests understanding of controlled substance regulations, a crucial area of pharmacy law. The mention of Vicodin, a Schedule II controlled substance, and refills highlights a strict rule set by the DEA. Federal law prohibits any refills for Schedule II medications because of their high potential for abuse and dependence. For example, if a patient needs more Vicodin, a completely new prescription from the prescriber is required. Always remember that Schedule II drugs require a new prescription for each fill, with no refills permitted. Question 9. Convert 0, 75 grams to milligrams, mg. I. 7, 5 mg. B. 75 milligrams. C. 750 milligrams. D. 7,500 milligrams. Answer C. 750 milligrams. This question assesses a fundamental pharmacy math skill, unit conversion within the metric system. The key is knowing the conversion factor between grams and milligrams. There are 1,000 milligrams in 1 gram. To convert grams to milligrams, you multiply the gram value by 1,000. So, 0, 75 grams asterisk 1,000 milligrams per gram equals 750 milligrams. Accurate conversions are essential for dosage calculations, as a mistake could lead to a significant overdose or underdose. A good way to remember this is that milli means 1,000, so 1 gram is 1,000 milligrams. Question 10. Which of the following is a critical step in the 5 rights of medication administration that helps prevent medication errors? I. Right time. B. Right prescriber. C. Right cost. D. Right pharmacy. Answer: I. Right time. This question tests knowledge of medication safety principles, specifically the 5 rights, which are crucial for preventing errors. The 5 rights are a foundational framework to ensure safe medication practices, and right time is one of them, alongside right patient, right drug, right dose, and right route. Checking the right time ensures the medication is given according to its scheduled interval, which impacts its effectiveness and patient safety. For instance, administering a medication too early or too late could affect its therapeutic level in the body. Remembering all 5 rights is a primary responsibility for anyone involved in medication management. Question 11. What is the appropriate beyond use date, BUD, for a non-aqueous, non-sterile compound if no stability data is available for its specific formulation? I. 6 months or the earliest expiration date of any ingredient, whichever is shorter. B. 1 year from the date of compounding. C. 14 days stored at controlled cold temperatures. D. 30 days from the date of compounding. Answer: I. 6 months or the earliest expiration date of any ingredient, whichever is shorter. This question assesses knowledge of non-sterile compounding guidelines, specifically concerning beyond use dating. The concept of beyond use date, BUD, is critical for ensuring the stability and potency of compounded preparations. For non-aqueous, meaning not containing water, non-sterile compounds, USP less than 795, guidelines state the bud should not be later than 6 months, or the earliest expiration date of any active pharmaceutical ingredient, API, whichever is shorter. This rule helps ensure the compound remains effective and safe throughout its use. For example, if an ingredient expires in 4 months, the bud for the compound would be 4 months, even if 6 months would normally apply. Adhering to these bud rules is essential for patient safety in compounding. Question 12. A prescription has DA1 indicated. What does DA1 signify? I. Dispense as written, generic substitution permitted. B. Dispense as written, prescriber requires brand name product. C. Dispense as written, pharmacist selected brand name product. D. Dispense as written, patient requested brand name product. Answer: B. Dispense as written, prescriber requires brand name product. This question tests understanding of DA codes, which are crucial for processing prescriptions correctly, especially regarding generic substitution. DA1 is a specific code indicating that the prescriber has explicitly chosen for the brand name product to be dispensed, even if a generic equivalent is available. It means dispense as written due to prescriber instruction. For instance, if a doctor writes Lipitor DA1, the pharmacy must dispense brand name Lipitor, not its generic equivalent, atorvastatin. Correctly interpreting DA codes prevents dispensing errors and ensures compliance with prescriber intent. Question 13. Which of the following medications is commonly associated with the side effect of purple glove syndrome when administered intravenously? I. Vancomycin. B. Phenytoin. C. Ciprofloxacin. D. Metronidazole. Answer: B. Phenytoin. This question tests knowledge of specific drug side effects, particularly concerning intravenous administration, which is important for patient safety. Phenytoin, an anti-epileptic drug, is known for a severe adverse reaction called purple glove syndrome when given intravenously, especially through peripheral lines or if extravasation occurs. This syndrome involves pain, edema, and discoloration of the limb, which can lead to tissue necrosis. While vancomycin has red man syndrome, purple glove syndrome is distinct to phenytoin. Recognizing such unique side effects is crucial for monitoring patients and preventing severe complications during drug administration. Question 14. What is the primary purpose of the Poison Prevention Packaging Act, PPPA? I. To regulate the disposal of hazardous materials in pharmacies. B. To require child-resistant packaging for most prescription drugs. C. To mandate tamper-evident packaging for over-the-counter medications. D. To establish safety standards for drug manufacturing facilities. Answer B. To require child-resistant packaging for most prescription drugs. This question assesses knowledge of key federal pharmacy laws, specifically the Poison Prevention Packaging Act, PPPA, the keyword primary purpose, and the Act's name itself directly point to its goal of preventing accidental poisoning in children. The PPPA mandates that most prescription medications and certain over-the-counter drugs be dispensed in child-resistant containers. For example, a pharmacy technician must ensure that a patient receives their hydrocodone in a safety cap, unless they specifically request a non-child-resistant cap. Understanding and applying PPPA guidelines is vital for protecting children from accidental drug ingestion. Question 15. A 200 milliliters 4 bag contains 500 milligrams of a drug. What is the concentration of the drug in mg/ml? I. 0.5 mg/ml. B. 2 milligrams per milliliter. C. 2.5 mg/ml. D. 5 milligrams per milliliter. Answer C. 2.5 mg/ml. This question tests the ability to calculate drug concentration, a basic yet critical pharmacy math skill. The key is to understand that concentration is the amount of solute drug per unit volume of solvent for fluid D. To find the concentration in mg/ml, you divide the total amount of drug, 500 mg, by the total volume of the solution, 200 ml. So, 500 milligrams/200 milliliters equals 2.5 mg/ml. Accurately determining drug concentrations is essential for safe and effective medication administration, particularly for 4 medications where precise dosing is paramount. Always ensure units cancel out correctly to arrive at the desired unit for your answer. Question 16. What is the pharmacy technician's role when a patient asks for advice on managing their chronic pain? I. Provide recommendations for over-the-counter pain relievers. B. Direct the patient to the pharmacist for counseling. C. Offer personal anecdotes about pain management. D. Suggest alternative therapies like acupuncture. Answer B. Direct the patient to the pharmacist for counseling. This question examines the appropriate scope of practice for a pharmacy technician, especially concerning patient counseling. When a patient asks for medical advice, such as managing chronic pain, it falls outside the technician's scope of practice. The keyword advice signals that the request requires professional clinical judgment. Pharmacy technicians should always refer such questions to the pharmacist, who is legally and professionally qualified to provide patient counseling and clinical recommendations. For instance, a technician might say, "I'm unable to provide medical advice, but the pharmacist would be happy to discuss your pain management options with you." Knowing your boundaries protects both the patient and the pharmacy. Question 17. Which statement accurately describes a laminar airflow workbench, IFW, used in sterile compounding? I. It creates a turbulent airflow to quickly remove contaminants. B. It provides an ISO Class 8 environment for non-sterile compounding. C. It uses HEPA-filtered air to create a unidirectional airflow within the work area. D. It is primarily used for handling hazardous drugs requiring negative pressure. Answer C. It uses HEPA-filtered air to create a unidirectional airflow within the work area. This question tests knowledge about equipment used in sterile compounding. The keyword laminar airflow workbench, LAFW, and the context of sterile compounding point to its function in maintaining a clean environment. An LAFW uses high-efficiency particulate air, HEPA, filters to generate a continuous, unidirectional, laminar flow of air that sweeps away airborne particles from the sterile work surface, providing an ISO Class 5 environment. This clean airstream is critical for preventing contamination during the preparation of sterile products. For example, when preparing an 4 admixture, a technician works within the LAFW sterile zone. Understanding the function of this equipment is fundamental to maintaining a septic technique. Question 18. Which DEA form is used to order Schedule II controlled substances? I. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 363. Answer C. DEA Form 222. This question assesses knowledge of specific DEA forms related to controlled substances, which is vital for pharmacy operations. The keyword Schedule II controlled substances and order clearly indicate the need for a specific, highly regulated form. DEA Form 222 is the official document required for purchasing, transferring, or selling Schedule II controlled substances. For example, when a pharmacy needs to replenish its supply of oxycodone, it must complete and submit a DEA Form 222. Correctly using and maintaining these forms is essential for legal compliance and preventing diversion of controlled substances. Question 19. Levothyroxine, Synthroid D, is primarily used to treat which condition? I. Hypothyroidism. B. Hyperthyroidism. C. Diabetes mellitus. D. Osteoporosis. Answer I. Hypothyroidism. This question tests knowledge of common medications and their primary therapeutic uses, essential for a pharmacy technician. Levothyroxine, commonly known by brand names like Synthroid, is a synthetic thyroid hormone. The condition hypothyroidism means an underactive thyroid gland that doesn't produce enough thyroid hormone. Therefore, levothyroxine is prescribed to replace the missing hormone. For example, a patient taking levothyroxine daily needs it to regulate their metabolism and energy levels. Remembering that levothyroxine replaces thyroid hormone helps connect it to treating an underactive thyroid. Question 20. A physician orders 1 liter of 0.9% normal saline to infuse over 8 hours. What is the flow rate in ml/hour? I. 100 milliliters per hour. B. 125 milliliters per hour. C. 150 milliliters per hour. D. 200 milliliters per hour. Answer B. 125 milliliters per hour. This question tests a common pharmacy calculation. For flow rate, the key information given is the total volume, 1 liter, and the total infusion time, 8 hours. First, convert 1 liter to milliliters. 1L equals 1,000 milliliters. Then, divide the total volume in ml by the total time in hours to get the flow rate in ml/hour. 1,000 milliliters/8 hours equals 125 milliliters per hour. Accurate flow rate calculations are crucial for patient safety, ensuring medications are administered at the correct speed to achieve therapeutic effects without causing harm. Always ensure units are consistent before performing calculations. Question 21. What does the acronym REMS stand for in pharmacy practice? I. Registered Electronic Medication System. B. Risk Evaluation and Mitigation Strategy. C. Routine Emergency Medical Supplies. D. Regulatory Education and Monitoring Standards. Answer B. Risk Evaluation and Mitigation Strategy. This question assesses knowledge of medication safety programs and regulatory terminology. The acronym REMS is a critical term in pharmacy, especially for certain high-risk medications. A risk evaluation and mitigation strategy, REMS, is a program required by the FDA for certain drugs with serious safety concerns to ensure that the benefits of the drug outweigh its risks. For example, some REMS programs might require specific prescriber training, patient counseling, or enrollment in a patient registry before a drug can be dispensed. Understanding REMS programs is vital for a technician's role in dispensing these specialized medications safely. Question 22. What is the term for a medication order that must be filled immediately? I. Stat. B. PRN. C. ASAP. D. Now. Answer I. Stat. This question tests understanding of common medical abbreviations used in prescription orders. The keyword immediately is the crucial clue here. Stat is a Latin abbreviation, statum, commonly used in healthcare to indicate that a medication or task must be performed at once or without delay. While ASAP and now also imply urgency, stat is the specific term used in pharmacy and medical settings for immediate action. For example, A stat order for an emergency drug takes priority over all other tasks. Recognizing and prioritizing stat orders is essential for patient safety, especially in hospital settings. Question 23. What is the correct order for donning, putting on personal protective equipment, PPE, for sterile compounding? I. Gown, mask, gloves, hair cover. B. Hair cover, mask, gown, gloves. C. Gloves, gown, mask, hair cover. D. Mask, hair cover, gown, gloves. Answer B. Hair cover, mask, gown, gloves. This question tests knowledge of proper aseptic technique and PPE use in sterile compounding. The concept of donning PPE for sterile compounding requires a specific sequence to minimize contamination. The correct order ensures that the cleanest items are put on last and that potential contaminants from clothing or hair are contained first, hair cover, then mask, followed by gown, and finally gloves. For instance, putting on gloves last ensures they remain sterile and untouched by other potentially contaminated PPE. Following this precise sequence is crucial for maintaining the sterility of the compounding environment and protecting the compounded sterile product. Question 24. A patient has a prescription for metformin. Which condition is metformin primarily used to treat? I. Asthma. B. Type 2 diabetes. C. High blood pressure. D. Heart failure. Answer B. Type 2 diabetes. This question tests recognition of common medications and their primary therapeutic uses, a core competency for pharmacy technicians. Metformin is a first-line medication specifically used to treat type 2 diabetes. It works by reducing glucose production by the liver and improving the body's sensitivity to insulin. For example, a patient taking metformin regularly is managing their blood sugar levels. Knowing the primary indications for frequently prescribed drugs like metformin is essential for accurate dispensing and patient safety. Question 25. A pharmacy needs to prepare 500 milliliters of 70% isopropyl alcohol from a 99% stock solution. How much 99% isopropyl alcohol is needed? I. Approximately 353, 5 ml. B. Approximately 300 milliliters. C. Approximately 495 milliliters. D. Approximately 250 milliliters. Answer I. Approximately 353, 5 ml. This question tests a pharmacy calculation involving dilution, specifically using the alligation method or a simpler C1V1 equals C2V2 formula. The problem asks for the volume of a higher concentration solution, C1 equals 99%, needed to make a lower concentration solution, C2 equals 70%, with a specific final volume, V2 equals 500 ml. Using the formula C1V1 equals C2V2, 99%, asterisk V1 equals 70%, asterisk 500 milliliters. Solving for V1 gives V1 equals 70 asterisk 500 slash 99 is equal to 35,000 slash 99, almost equals 353, 535 ml. This calculation is vital for accurately compounding solutions in the pharmacy. Always ensure your calculations are precise to avoid errors in medication preparation. Question 26. Which government agency is responsible for approving new drugs for market release in the United States? I. Drug Enforcement Administration. D. B. Centers for Disease Control and Prevention. CDC. C. Food and Drug Administration. FDA. D. National Institutes of Health. NIH. Answer C. Food and Drug Administration, FDA. This question assesses knowledge of key regulatory bodies in pharmacy law. The phrase approving new drugs for market release is the primary function of the Food and Drug Administration, FDA. The FDA is responsible for ensuring the safety, efficacy, and security of human and veterinary drugs, biological products, and medical devices. For example, before a pharmaceutical company can sell a new medication, it must undergo rigorous testing and receive FDA approval. Understanding the FDA's role is fundamental to appreciating the regulatory framework that ensures drug safety. Question 27. What is the process of physically checking in and storing newly arrived medication inventory in the pharmacy called? A. Ordering. B. Dispensing. C. Receiving. D. Auditing. Answer C. Receiving. This question tests knowledge of pharmacy inventory management processes. The keywords checking in and storing newly arrived medication inventory describe the receiving process. Receiving involves inspecting incoming shipments against purchase orders, checking for damaged goods, verifying quantities, and ensuring proper storage conditions. For instance, when a drug order arrives, a technician opens the boxes, compares the contents to the invoice, and places medications on shelves. Proper receiving procedures are essential for maintaining accurate inventory, preventing errors, and ensuring product integrity. Question 28. What is the brand name for omeprazole? A. Nexium. B. Prilosec. C. Protonix. D. Prevacid. Answer B. Prilosec. This question tests recognition of common brand and generic drug names, a critical skill for a pharmacy technician. Omeprazole is a widely used proton pump inhibitor, PPI, and its most common brand name is Prilosec. The other options are also PPIs, but they correspond to different generic names. Nexium is esomeprazole, Protonix is pantoprazole, Prevacid is lansoprazole. For example, if a patient requests Prilosec, a technician should know to look for omeprazole or its brand. Familiarity with the top 200 brand/generic pairs is vital for efficient and accurate prescription processing. Question 29. A pharmacy technician identifies an expired medication on the shelf. What is the next immediate step? A. Return it to the manufacturer immediately. B. Place it back on the shelf for later processing. C. Remove it from active stock and quarantine it for proper disposal. D. Dispense it quickly before its expiration date. Answer C. Remove it from active stock and quarantine it for proper disposal. This question assesses proper inventory management and medication safety protocols regarding expired drugs. The keyword expired medication signals a critical safety issue. The immediate next step is to remove the expired medication from active stock to prevent accidental dispensing, and then quarantine it in a designated area for proper disposal. Dispensing expired medication is a significant patient safety risk and is illegal. For instance, placing the expired drug in a clearly marked quarantine bin ensures it won't be mixed with usable stock while awaiting return or destruction. Always prioritize removing expired medications from patient access to ensure safety. Question 30. Which schedule of controlled substances has the highest potential for abuse and has no accepted medical use? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer I. Schedule 1. This question tests knowledge of the Controlled Substances Act, CSA, and the scheduling of drugs based on their abuse potential and medical use. The phrases highest potential for abuse and no accepted medical use are the defining characteristics of Schedule 1 controlled substances. These drugs, like heroin or LSD, are typically not available in pharmacies. Schedule 2 drugs, while having high abuse potential, do have accepted medical uses, e.g., oxycodone. Understanding the differences between these schedules is fundamental for proper handling and legal compliance. It's important to remember that Schedule 1 drugs are considered the most dangerous and strictly prohibited. Question 31. A pediatric patient weighs 22 pounds. How many kilograms, kg, does the patient weigh? A. 5 kilograms. B. 10 kilograms. C. 15 kilograms. D. 20 kilograms. Answer B. 10 kilograms. This question tests a crucial pharmacy math skill, converting patient weight from pounds to kilograms, especially important for pediatric dosing. The key conversion factor to remember is that 1 kilogram is approximately equal to 2 pounds. To convert pounds to kilograms, you divide the weight in pounds by 2. So 22 pounds slash 2 lbs slash kg equals 10 kilograms. Accurate weight conversion is essential for calculating correct drug dosages in children, where small errors can have serious consequences. Always ensure precise calculations when converting patient weights. Question 32. What technique is used to ensure a uniform mixture when compounding an ointment containing ingredients of unequal quantities? A. Levigation. B. Trituration. C. Geometric dilution. D. Spatulation. Answer C. Geometric dilution. This question assesses knowledge of non-sterile compounding techniques. The concept uniform mixture when combining unequal quantities of ingredients in an ointment directly points to geometric dilution. This technique involves mixing the smallest quantity of an ingredient with an equal amount of the base or diluent, then successively doubling the mixture by adding equal amounts of the remaining ingredients. This ensures even distribution throughout the final product. For example, if you need to mix 1 gram of a potent drug into 100 grams of ointment base, you would use geometric dilution. Using this method is critical for accurate dosing and consistent product quality in compounded preparations. Question 33. Which of the following drug classes is known for a significant interaction with grapefruit juice? A. Beta blockers. B. ACE inhibitors. C. Statins. D. Antibiotics. Answer C. Statins. This question tests knowledge of common drug-food interactions, an important aspect of medication safety. The keyword grapefruit juice is a strong indicator for certain drug classes, particularly statins, HMG-CoA reductase inhibitors like simvastatin and atorvastatin. Grapefruit juice can inhibit an enzyme, CYP3A4, in the gut, which metabolizes these drugs, leading to increased drug levels in the bloodstream and potentially enhancing side effects like muscle pain or liver damage. For example, a patient on simvastatin should be advised to avoid grapefruit juice. Always be aware of significant drug-food interactions to ensure patient safety and medication effectiveness. Question 34. According to federal law, which of the following is not required on the label of an over-the-counter OTS medication? A. Active ingredients. B. Directions for use. C. Pharmacy phone number. D. Warnings and precautions. Answer C. Pharmacy phone number. This question assesses knowledge of federal labeling requirements, specifically for over-the-counter OTS medications. The phrase "not required" is the crucial clue. OTC labels must include information like active ingredients, uses, warnings, inactive ingredients, and directions for use to ensure safe self-medication by the consumer. However, the pharmacy's phone number is specific to dispensed prescription medications and is not a federal requirement for manufacturer-labeled OTC products. For example, when you pick up a box of ibuprofen, you'll see all the required drug facts, but not the phone number of the store where you bought it. Understanding these labeling differences is important for pharmacy practice. Question 35. What is the primary goal of a quality assurance program in a pharmacy? A. To increase pharmacy profits. B. To minimize the risk of medication errors and improve patient safety. C. To accelerate the dispensing process. D. To reduce the number of staff required. Answer B. To minimize the risk of medication errors and improve patient safety. This question tests understanding of quality assurance principles in pharmacy. The keywords primary goal and quality assurance point directly to the program's core purpose. A quality assurance program systematically monitors and evaluates various aspects of pharmacy services to identify and correct issues, ultimately minimizing the risk of medication errors and enhancing patient safety. For instance, a quality assurance review might analyze dispensing errors to implement better workflow procedures. Remember that quality assurance is fundamentally about continuously improving processes to ensure the highest standards of patient care and safety.